It's Concerned Dr. Miskoff. It's April 15th, 2020. It's coming up on 9 p.m. And as the weeks roll on, start to feel the monotony of, patients coming in one after the next with a COVID-19 diagnosis. It turns out that it seems at least that over 90% of the patients that we're seeing do have COVID-19, if not more. And although there did seem to be a slight decline, just when you feel like it's the numbers are going down, another 3, 5, 6 come in through the ER, all with almost the identical same story, very similar X-rays, fever usually involved, at least in half, shortness of breath, cough, and some GI symptoms. It's very, very uniform, and as we take care of more and more of them, the protocols have formed. We're kind of doing everything at this point by protocol, but every couple days there's something new. One of my colleagues was utilizing, and I tried it a couple times, colchicine, an older medication for gout, which has anti-inflammatory. We've used it for pericarditis and Dressler syndrome, but too soon to tell if it's doing anything. I saw a request on a message to look at acetazolamide from 2 or 3 people, and I did find an article about at least the theoretical reasons why acetazolamide, a carbonic anhydrase inhibitor, may in fact have some treatment benefit in regards to the pulmonary edema component, and it's been used for high altitude pulmonary edema in people that develop volume overload or pulmonary edema type picture when they're at high altitudes. There are several medications, including acetazolamide or Diamox. Some have used calcium blockers, other diuretics, oxygen therapy, of course. A lot of this is very similar in how these patients present. So those are just some of the quick updates. But tonight, really, I wanted to take a couple moments just to describe my experiences, both at 9/11. I had left training in Philadelphia and gone to New York City with my wife around June, starting July of 2001, and shortly after that 9/11 occurred. And certainly it was a traumatic experience, especially you didn't expect it. Moved into New York, really happy to start at Beth Israel, and had a great experience there over those 3 years. But what a kick in the butt to get there, and that's really the first event that occurred. And we were mobilizing ICUs that day, and we were talking about sharing ventilators if there was a major casualties. The fact of the night is that 2,977 humans were lost on 9/11, at least at the World Trade Center, or victims, I should say. There was an additional 19 hijackers. Total that together, 2,996 deaths just at the site. Again, it was a terrorist act. We don't at least believe that COVID-19 is a terrorist act, but I'd like to compare and contrast the two. As far as the planning goes for 9/11, as far as we knew, nothing was different that morning. I was rounding in an uptown at the Beth Israel satellite near Gracie Mansion. That day, I was working with Dr. Liss, and I remember watching on TV as we're rounding early in the morning this happening, and literally him taking action to mobilize that ICU, over 10 miles from the site, where the downtown main hospital was also getting ready, and all the hospitals that were closer. With the pandemic, we heard about this obviously at the end of the year in China. We knew about it in Washington State in mid-January, and there was at least some time in warning, albeit it may have been slightly delayed, to prepare for this. And still, we find ourselves drowning in patients and many deaths, and many more deaths with this pandemic, with COVID-19, than with 9/11. And remember, thinking back how terrible it was that we had lost, and at first I think they were estimating, as I recall, 4,000, 5,000. I remember seeing numbers like that on TV in 01, and then eventually we knew it was just shy of 3,000 lives. Today, the numbers internationally for COVID-19, 2,047,731 diagnosed confirmed cases, and 133,354 deaths internationally. And this is just what's been reported. We know there's been underreporting in a lot of countries. We know that testing hasn't occurred on so many, we think on so many people that were either asymptomatic or had mild symptoms and never got tested, or the testing just didn't exist earlier on, so you couldn't get it done. So we don't know if that number is double, triple, quadruple, who knows? In the United States, 632,878 confirmed diagnoses as of today, with unfortunately 27,850 deaths. So many more than 9/11, and unfortunately, models projecting over 60,000 deaths. And that's, if we get this under control as it's being suggested. I think with 9/11, one of the biggest things was how shocking it was. Again, rounding in an ICU, looking up at the TVs, people at work. I can't even imagine being near the site. And then the planes hitting the towers, of course, it was just such a shock effect, and how people were dying and had to jump from buildings and were trapped inside, just completely awful and horrendous. Not that the pandemic is significantly better, but the patients are getting admitted. They seem to either make it past that sort of 1 to 2 week mark, or they're somewhere in that 8, 10, 12 day, as we said. We see them flare up with the fevers again, and the infiltrates tend to worsen, and then they either pull through it in a sort of sleeping on their belly position, with all these random medicines that we're trialing, and interleukin-6 blockers, and of course hydroxychloroquine when they're desaturating to 92%. But what's just as terrible about the death, I think, is that they're dying without their family members, and they're not allowed to be there, and it's just so awful. Of course, our staff are amazing, and a lot of them have taken it on themselves to comfort these patients, but still alone, if you will, when they're dying. I definitely had some paranoia and PTSD symptoms after 9/11. I remember, driving through the tunnels, going back and forth New Jersey, New York, and for many months, just you always think twice when you pulled into that tunnel, what's going to happen? The terrorist effect definitely played a part, but it wore off, and I fear that with COVID-19, until the treatments are wrapped down, until they can prevent it, with vaccines, and hopefully they're going to be a lot more effective than influenza. We're hearing more about the vaccines, but we'll always have this in the back of our mind, and we may be wearing masks in public for a long time. I mean, really, until it's completely eradicated, until patients aren't coming into the ER, until there's no more cases. There's always going to be a fear in some of our minds, or in most of our minds, and I just hope we don't find ourselves in 2021 eating at restaurants with masks on, and sneaking the mask off to take a bite. That would be awful. So hopefully the treatments, and they do feel strongly when you do reading on this and listen to the experts, that spike protein can be dealt with, and that a vaccine is, well, they're already testing it. They've already given it to a number of people, 40 or so, and there's 3 active, going into human trials, or in human trials, and 70 or so are working on vaccines, and all these treatments, and we should be able to figure this out, but it still may take a year or two before it's commercialized and they can produce enough to supply it. So until those cases are wiped out, there's going to be that I think psychological, at the very least, effect. Either way, both changed life in the areas that they affected. Of course, New York City and around the world, people felt it and sent their love and donations. With the pandemic, it's certainly more global and affecting, society after society, community after community. Both were sort of silent killers, right? Those who were in the tower didn't expect it, and yet, with the pandemic, an asymptomatic carrier, they're saying more and more that those who don't have symptoms may be more contagious earlier on. That you were one study, showing that as you later on in the illness may actually be less contagious. And then there's these people that are testing positive 4, 5, 6 weeks later that have minimal symptoms, and how contagious they are. Most likely their viral loads are very low, or they're not contagious at that point, but we just don't know. And whether or not the amount of viral load that you take in on that first sort of inoculation or inhalation, if you will, or mucosal membrane, once it goes across the mucous membranes of the nose or the mouth or even the eye, does that matter? Are healthcare providers or frontline workers getting exposed to this at low levels, and their immune system's able to fight it off? But it's that once you go over that sort of critical mass of viral load, that the patient or the person can't beat it, and how strong their immune system is at the base, and more information about what's beneficial or protective with COVID? Is it the extra X chromosome with that hyperimmune or more ramped up immune response that the female may have that can fight it off, or is it estrogen or testosterone or melatonin? And all these different things are being looked at and considered. But again, overall, there was global changes from both incidents. I think obviously more the pandemic is affecting the world. So more is on the way. Antibody testing is on the way. With 9/11, the treatment was prevention, right? Was to take safeguards, to lock the plane cabin doors. From you can't get to the pilot, and to they were doing wiretaps and cracking down on terrorist groups. This type of thing, sort of preventative measures, is what you can do. With COVID-19, it's going to be preventative in the form of vaccines. It's going to be treatment, kind of like influenza. And of course, better hygiene and more cautious when you are in society. Not touching the face will be a regular practice, I believe. Whether or not, again, we wear masks chronically will be determined. So that'll wrap it up for tonight. I definitely wanted to take that moment or two to give my experiences living in New York City and experiencing 9/11, and of course now living in New Jersey and experiencing COVID-19. Again, both very, very terrible. Not much in the way of silver lining. Yeah, there's been a couple good things come out of COVID-19. Crime is down right now. Pollution is down right now. Deaths from other things are down right now. Less car accidents and these types of things. But again, both affecting us mentally, physically, socially, and probably forever. Everybody have a great night and stay well.